Should pharmacists independently practice medicine? Well, the obvious answer is no, but apparently there's about 55 congressmen who think that the answer is yes. Recently, a bill has been introduced, H.R. 3164, and its companion bill, Senate Resolution 2426, which allows pharmacists to independently test patients for certain things like COVID-19, influenza, RSV, and even streptococcal tonsillitis or pharyngitis. But not only test, also treat the patient, evaluate and manage that patient, and bill Medicare under an E&M service code without a physician being involved. That is the independent practice of medicine by pharmacists. And you know, pharmacists did not go to medical school. And 95% of the country believes that a physician should be involved in any treatment decision that involves a prescription of medication or a test. That's the best kind of healthcare. And we expect in this country that significant medical decisions, testing and treating for a disease, are physician-led as part of a team, but nonetheless physician-supervised, and that somewhere along the way a physician is involved if you're being diagnosed and treating these conditions. You know, going into a pharmacy and having them swab you and then selecting an antibiotic does not involve the pharmacist taking a history or performing a physical. And oftentimes the diagnosis of even these conditions involves more than just a CLIA test swab and a result. Plus, the pharmacist is not really taking your whole medical care into consideration because they aren't taking an adequate history. They don't know how to take an adequate history. So this is not good care. It's not good for patients. There is no urgent need for this. This is not endemic or pandemic times. And there's no reason to lower the bar and let pharmacists all of a sudden start practice medicine independently. You know, the other thing is that pharmacists are not pushing for this. They're extremely understaffed and overworked right now, even to the point many are raising safety issues because they are just so understaffed. They don't need this on their plate as well. Plus, it opens them up for much more liability. It's the big box pharmacies that are pushing this. It's the CVS and the Walgreens and the Walmarts who want to turn their pharmacies into treatment centers as opposed to pharmacy centers. And that's really what the motivation of this is. So I hope you'll join these many other medical societies that we've listed, medical associations, as well as specialty societies all across the country, when we ask Congress to oppose H.R. 3164, S.R. 2426, because it's bad for patients and lets pharmacists practice medicine, which is not something a pharmacist should be doing.